Within a primary breast cancer, one can see a part of the cancer that's positive for HER2 and a part that's negative for HER2, or a part that's estrogen sensitive and part that's not estrogen sensitive. So when we see that heterogeneity within the primary tumor, how does that affect therapy? What should we actually be treating? Should I be giving chemotherapy for the part that's estrogen receptor negative and hormonal therapy for the part that's estrogen receptor positive? So determining in the clinic what that heterogeneity means turns out to be very important. We have some initial answers. In the ASCO-CAP guidelines, for instance, for HER2 positive disease, we actually have a cutoff for what we call positive. It's cut at 10% at this point of cells staining positively for HER2 to call that. So we accept a fair amount of heterogeneity and still call something HER2 positive. Now, in the metastatic setting, if we compare a primary breast cancer to say a first site of metastasis for a patient who's relapsed, we've learned in recent years that there may be significant differences between the primary and the metastatic site. Some tumors that start out being estrogen receptor positive will turn out to be estrogen receptor negative after they have undergone the Darwinian pressure of hormonal therapy. Some tumors that were HER2 negative in the initial tumor will now be HER2 positive in the metastatic tumor, and therefore may benefit from HER2 targeting therapies such as trastuzumab or pertuzumab. So we've learned to rebiopsy patients at the time of metastatic disease so that we can look at these biomarkers and actually use them in terms of treating patients. But as we learn more and more, the level of complexity of this heterogeneity just gets greater and greater. We're learning about it at a genomic level. As a result of studies looking at deep sequencing of breast cancers, we can now look at exactly which mutations are present. And again, at that very deep sequencing level, a very deep dive into the tumor, we're increasingly seeing that heterogeneity is a major issue, and indeed a major problem for our patients. One recent study looking at breast cancers in terms of tumor heterogeneity came to the conclusion that no two human breast cancer cells in the same patient, no two cancer cells have exactly the same human genome. Something that's frightening, perhaps somewhat surprising, but certainly important.